Western Mass News is getting answers after recent complaints to our newsroom and on social media about long wait times at area hospital emergency rooms. Welcome, everyone, to Western Mass News at 6 on this Tuesday. I'm Chris Pisano.
And I'm Mary Wilson. Western Mass News reporter Kristen Burnell joins us live in studio with more. Kristen?
Chris and Mary, we've seen posts about people spending, in some cases, hours in the emergency room waiting for care. I brought the issue to hospital leaders in Western Mass to get answers about what is stressing the system right now. Posts on Facebook caught our attention. One reads, quote, "I'm going on almost 12 hours at the emergency room with my mother who is very ill, and there has been no movement." A comment on that post reads, "That also happened to me twice." So Western Mass News reached out to get answers from several local hospitals about what their emergency departments are dealing with right now.
We certainly have seen challenges, not just in Mass, not just in Western Mass, in the whole of the state, as well as the nation, with an increased influx of patients into the emergency rooms ever since the pandemic started winding down.
President and CEO of Holyoke Medical Center, Spiros Hatiras, tells Western Mass News there are numerous factors contributing to longer wait times in their emergency department.
Some researchers believe that medical care that was postponed during the 2 years of the pandemic is kind of not catching up to people, and so we see a lot more sick people.
He tells us they are seeing more people come into the emergency room who do not require emergency attention for conditions like an earache, and staffing shortages have also been an issue at the hospital.
Many people have left during the pandemic. It's hard to recruit, and we see a big shortage of nursing as well, and we've done a lot of things to try to recruit nursing.
And over in Springfield, the chair of emergency medicine at Bay State Health tells us they are experiencing similar issues. We asked what a typical wait time is at their ER.
It all depends on the acuity of the patient. So patients that come in with true emergencies, we see right away.
He is also urging the community to call primary care physicians first before heading to the emergency room for care.
Patients sometimes don't call their primary care physician first and come to the ED. I actually think that primary care physicians, or PCPs as we call them, have a really important role in terms of determining where care is best delivered.
We also reached out to Mercy Medical Center in Springfield for a statement regarding wait times at their emergency room, and they tell us in a statement in part, quote, "We are currently expanding Mercy's emergency department and expect to open additional space in the coming months to meet community need." Reporting live in studio, Kristen Burnell, Western Mass News.
Thank you.